Dr. Rosenberg here. Today we are going to talk a little bit about injections. Injections come in many shapes and sizes and variations, and of course it depends a little bit on what you're injecting. But for the most part, physicians use a combination of an anesthetic, in my case I use lidocaine, and a cortisone of some kind. In my case, I actually use a combination of a short-acting cortisone and a long-acting cortisone, dexamethasone and kenalog. And I use that combination to inject muscles and joints to reduce inflammation and scarring in muscles and joints. That combination is very safe. Many patients are concerned, I don't want to take steroids, I've heard about all the side effects, so forth and so on. But that's a misunderstanding. It's a misunderstanding because everything you read about with these athletes taking steroids has to do with oral steroids or anabolic injections of steroids. That's not what we're doing. We're using a human preparation. We're injecting a small amount in a local area. So there really is very limited systemic absorption into your body, which means you get none of those side effects. You're not going to get a brain tumor, you're not going to have kidney failure, you're not going to have any of those things that steroids can do to you when you take them by mouth or in large anabolic injections. Instead, you're going to have pain relief from the anesthetic, and the steroid is actually going to work at the cause of the pain. So in a muscle trigger point injection, for example, the trigger point is scar tissue. The steroid has enzymes in it that melt the scar tissue. Therefore, you're removing the cause of the pain, not just treating the pain with the anesthetic. Very, very, very important to understand. Now, more recently, especially when you're talking about large muscles and severe spasm, they've approved the use of Botox for these large muscle injections. Now this has been used primarily previously on patients with severe neurological disorders, multiple sclerosis, cerebral palsy. These are people with horrible twisting, pretzel-like spasms, where the Botox just knocks out the muscle and they can be more functional. Well, they have now found it safe to do in patients with neck tightness or back tightness, where if the whole muscle is involved, we can use Botox. If a piece of the muscle is involved, we can use cortisone. And again, here we don't give injections in isolation. That's what makes us unique, because some places will give you an injection, some places will give you medicine, some places will give you therapy, some places will give you massage. We do the injection, the medicine, the therapy, the massage, and the exercise all in one comprehensive package. And when you gang up on the patient, it usually works best. Last thing to comment on is, does it hurt? Because cortisone and Botox injections can be painful. Well, once again, I would say they're only painful depending on who does the procedure. When you have a lot of experience, I, for example, will always take the extra 2 minutes to numb the area first. That makes the entire injection procedure painless. The only thing you feel is a little pinch when we numb it. Other doctors, for whatever reason, just come in and give the injection. And when you're injecting a thick, viscous liquid like cortisone through a large bore needle, that hurts, unless it's been numbed first. So rest assured, if you wind up with an injection here, you'll be pleasantly surprised. It doesn't hurt.